Okay, hello, everyone. We have a quorum and we're going to have the meeting come to order. It is 6:40 p.m. And so as I mentioned, we do have a quorum that's present. And I see that Monique is virtual, so I'll put her as a virtual. And I'm hoping though we have a quorum, I'm hoping the two committee members that are not present now will soon come in. So you,
Laquita, sorry, good evening, thank you. For some reason, I thought we were doing this virtually, or I would have come in, so I apologize.
okay, I just haven't, meetings are still always in person for the committee.
Yeah.
But there hasn't been an actual ruling. Remember, we had that hearing, Manhattan Borough President called a hearing on the virtual meetings, and there were a lot of people, hey, Liz, okay, sign in right there. Thank you for coming. So I don't know if the jury is going to change on this.
Okay.
But, we do have 5 of our committee members present.
Yeah. Oh, so like I said, I misread the I misread the email, so I apologize for that, or I would have made my way over there, but I'm glad I'm able to be here. So there you go.
Did I get one? This is when you present. Okay, so all right, thank you, Monique. So we have a majority of our people here. Then, of course, we have some virtual. Can we have an adoption of the a motion to adopt the agenda, or is there anything that you have that you want to add to the agenda as you see it now? Anyone want to add anything? So can I have a motion to adopt the agenda? Motion. Okay, so it's been moved by Amir, seconded by Liz Eastman. All those in favor? Okay, thank you. Now, the middle, we have a terrific job. Hey, Carl, next door. We have a terrific job that was done on the minutes. It actually is not they weren't minutes, they were done by Clotilde. It was really comprehensive. And there was a 3-pager that she said she did, but I didn't see it. So I know this is too much now, but for November, even though it's a lot, she pretty much is, it's like she typed word for word. If anyone looked at it, she did a terrific job. But you have a 3-pager. Yeah, and I can't find it. So what we can do is, she did do them, and you see how comprehensive her long minutes are. So do you want to just approve the November minutes, and then if we see something added by sending a correction or other email as an email? How do you want to do it?
I would say I move to approve the minutes pending any minor edits or changes.
And we will have a reduced version. Is there a second? Okay, so it's been properly moved by Monique to accept the minutes and seconded by Amir. Can we, all those in favor?
Aye.
Okay, thank you. That it's been moved. So at least we can submit November minutes of the committee to the executive committee. Is Patricia Ramos here? Patricia, I haven't seen her. She has done such a wonderful job with the minutes. Maybe she just got burned out. But I don't see her on virtually either. So I don't know. Hopefully she hasn't given up on us, because there is a lot of work. Okay, now in terms of announcements, again, if we could just have very brief announcements related to Narcan training. The Harlem Health Initiative had announced that they have a Narcan training session Is Tomisha Hicks available with the CUNY program, or someone from the CUNY School of Public Health and Health Policy available to say, respond on that?
Mhm.
Yes, hi. Tamisha's here. Nice to meet you all in full. Sorry, I
Yeah,
couldn't be here in
welcome.
person.
Okay, thank you. Can you just give us an announcement on the Narcan training? That came up a couple of months ago because with all that's been happening with overdoses in our community and all, we felt that there were people in the community, if they can help someone, a family member, or a friend, then this training would be significant. So, tell me about your training, the Narcan training.
Yeah, so it's going to be a 3-part series because, like you said, there was a lot of interest. So the first one is actually this January 11th. It's full. However, we are taking applications for our February 7th session, and that'll be with the New York City Department of Mental Health and Health Hygiene, Department of Health and Mental Hygiene. And so it'll be attendees that will receive a Narcan bag for free and test strips for fentanyl and TRANQ. You don't really need any prerequisites. There's no extra training you need. It's a free training. Registration is required because the space is limited. Like I said, the session this week is full. It takes about an hour. I'm going to put the link in the chat here. It'll be located, the training is going to be located at our school on 125th. So it's 55 West 125th Street. I'm going to put all of that in the chat as I'm speaking now.
Okay, for us here, I guess let me see if I can open the chat. Can you just state it anyway for those who are here in person? Oh, wait a minute, there it was. Let me go back. It did appear on the screen. Uh-oh, what am I doing? Get out of that. It appeared the minute I saw it, then I hit share by mistake.
Okay, I'll put it back in the chat for you. Give me 1 second. So this link is to the January 11th session. And so what we're doing with this, once you register for the January 11th, we're going to push you to the February 7th one, but you'll get an email about it. Since it's already full, that allows us to kind of keep track of the waiting list. So that way people who kind of have already registered go first for that February 7th session. And then those people who are coming in get in line. So once you click that link, it'll send you to the whole series of the January 11th, February 7th sessions.
Okay, and January 11th is full, but February 7th is also going to be at 55 West 125th Street. And what time?
West 150 at 2 p.m. Wait, let me make sure.
And it's 2 to 3. I know you said an hour.
Yes, ma'am. 5th Street.
Okay, 55 West 125th Street, from 2 to 3. Anything else, Tamisha? Related to that?
Yeah, sorry, the fire station was passing by, but no, that's it. If I can really quick put in one more plug, we have another webinar coming up this week. It's the second part to our rising rates of congenital syphilis and access to care webinar, also with Department of Health and Mental Hygiene. And so that one is just kind of concentrating on the syphilis rates, especially in New York City. And so the speakers are kind of going to emphasize on the understanding of the need to access to care for it, as well as providing other resources and existing resources to patients who kind of need that care. And then also next action steps for community-based organization. And so as we think about the rising rates, especially after COVID, not only with syphilis, but other STIs and STDs, what other action steps community-based organizations who kind of focus on that area can do to help out with patients who need kind of access to care or existing resources that are already there. Let me put this.
I'd also like to take this time to just say that we would love for the CUNY program to be involved with our March 16 Public Health Forum. I mentioned it at the December meeting, actually at the November meeting, and when Debbie was here. So you'll get a letter. We have one letter that's already, the first letter actually has gone out today, but I've been talking to people, and so you'll get a formal request. Ms. Levine will to participate, to have a booth, a talk session, or repeat some of the initiatives that you guys have. sign people up. The forum will take place at 605 West 125th Street. We'll talk about that a little later. But
Okay.
please keep that in
I'll put
mind.
a hold on the calendar. Is this all day event? Is it at a specific time?
11, it's gonna come up shortly in this discussion.
Okay.
Okay?
That sounds good. Thank you. I'll put a hold on the calendar.
Okay, now, I'm not sure, I thought someone from DOH, also mentioned a Narcan training session. That could have been Cheyenne, I'm not sure if Cheyenne is here.
Excuse me, look, Chair, before you move on,
Right.
Luquita, I just had a quick question. I have my hand up.
Oh, I'm sorry, I need your guys' help too, if you see a hand raised. Okay, Monique.
Tamisha, question, is the Narcan session is going to be recorded and then made available?
That one I'm not too sure about. I'm thinking since it's something that DOH MH does pretty frequently. I don't think so. I can check with
Okay.
Priya and see. I'll send her a quick text and then I'll shoot it in the chat if I get an answer while we're here.
Okay,
Okay, great.
all right, thank you.
Right, and that's a good question, because anything that, say, CUNY or any of the other organizations that I've asked to participate has, from the standpoint of video, if you have a table or booth, that could be made available, and there'll be a mail, a handout, or something mailed for you to check off what your needs might be. And hopefully that will be in the mail this week.
Okay.
Hopefully tomorrow even, because I've talked about it enough to different people. It's just, I need to get the sign up sheets now. Okay, is Cheyenne here? Cheyenne Murillo? Or, oh, I see, Pauline Ferranti. Pauline, do you know anything about the Narcan training program at DOHMH?
I don't have any specific information, but I can send you the web link to the Narcan page, where it does give information about trainings if people are interested. And also, I think we believe that we prefer in-person training just so we can show people how to actually use the apparatus, and so that they, you know, have more of an understanding. And also, if you attend in person, you actually get the Narcan bag, and you would get test strips as well. So I think it's important for people to be there in person, but I don't know whether or not they're available via Zoom, but I'm also happy to find out.
Okay, and Cheyenne did put something that I don't have available in the chat, because we haven't, maybe we could pull it from that discussion or presentation in December. Thank you, Pauline.
No problem.
And then Monica Dula was working on one for the committee, or for CB9. And I know she was waiting to follow up, but I don't see her. Let me see if I see her among the participants that we have. Let's see if there's a list. And I don't hear her voice, because maybe she would have spoken up. No, I don't see it there. So if we get one off the ground, that would be great. Otherwise, it's really important for us to spread the word where that training is taking place. So that's still good. We'll move forward with the Pauline. If we'll come back to you. Do you have what can you report on with the Department of Health and Mental Health? I know there should be a lot of urgent information out there as of a couple of days ago related to COVID and flu.
Yes. Yes,
Okay.
happy
So
to
this
share
is
some
Pauline
information.
Ferranti, who is the Manhattan Community Liaison Office of External Affairs for Department of Health, Mental Health. Okay, Pauline.
Hi, everyone. So yes, there are reports that there is an increase of both flu and COVID cases occurring not only in New York, but nationwide. And so it's really important that people get up to date with their vaccinations. The chances of you getting both flu and COVID at the same time, though, are very low. So I think people, if they're concerned about that, to be less so concerned about that. But of course, there is still the risk of catching either flu, RSV, or COVID. So we are encouraging everyone to continue to wear face coverings when you are in public transportation or crowded areas, especially, you know, during the holidays that just passed. We really try to get that messaging out as well. But also, if you are feeling ill, it's important to get tested and treated as soon as possible, because that does limit or eliminate or, you know, reduce the chances of you having to be hospitalized. So, you know, it's really important to just, you know, monitor your health, make sure that if you are not feeling well, that you stay home, get tested and get treatment as soon as possible. So those are the updates with regards to flu, RSV, and COVID. Other than that, at the end of last year, we launched Teen Space, which is like an online teen mental health service that's free to teenagers. It does require guardian consent, but it's a tool that we hope teens in New York City will utilize to find, you know, a space where they can share some of their concerns, or to have a safe space where they can talk about any of the mental health concerns that they're struggling with. So I am happy to put a link to that into the chat as well. But I think it's especially important among our young folks that they get the support that they need in terms of addressing any mental health concerns that they may have. So I think that's a really exciting program that was launched through the health department and through the city. And those are my main updates, and I'm happy to take any questions people may have.
Repeat the name of the video again.
Oh, it's like an online tool. It's called Teen Space. And
Okay.
I'll put the link into the chat.
And they're supposed to use that with adult guidance, and how is that?
Right. So it's like an app that a teen can use to speak with a counselor or to get some mental health support. But prior to them being able to utilize all the services within the app, they would need parental consent to do so, because of course they are still minors. This is geared towards teenagers, so from 13 to 17. So of course, you know, parental consent or guardian consent would be necessary, but it's really for teens to utilize a resource to help them navigate through a lot of many of the mental health concerns that you struggle with as a teen. So it's a very innovative new project, and I'll put the information into the chat.
Okay. Are there any questions for Pauline related to that, or to anything else happening at DOH-MH? I know that we have to find ways of really encouraging vaccinations. You know, I know there's some people who are still opposed, but I don't think it's as great as it was. I mean, it's still a significant number who are find some reason. But for those who are not opposed but just haven't done it, encourage it, because what I find happening is that with COVID, RSV, and the flu, where people more recently are saying, well, I had the flu, but it's only afterwards that I've talked to friends of mine or acquaintances, oh, I had COVID. And it's just amazing across the country, people are still keeping quiet about it, like there's some stigma. And I think we have to find a way to, you know, say more about that. Maybe Anita reintroduce our COVID immunization program that you had designed for CB9, encouraging the vaccinations. But, you know, we can't, it's hard to convince people who feel they don't need it or are allergic or just medically can't take it, but there are enough people getting the vaccine, it will critically reduce the number of people coming into contact with COVID, the virus itself. And Pauline, can you accept this as an invitation for DOHMH to be at our Saturday, March 16th forum, where hopefully you guys have a booth and, literature or table. I mean, you can actually have a booth display if there's something that, an information tool that you have via the booth.
Yes, absolutely.
Okay, so, I know I'm mentioning, same thing I mentioned before, and you will get a formal letter, but, an email, okay? And whoever can be there and provide, tools for us, that would be great. Information, pamphlets or videos. We'll be in touch this week.
Okay.
Okay,
Great.
so now, we're gonna move on to our, public health forum. We've been talking about it. It will take place on March 16, Columbia Forum, which is at 605 West 125th Street. That's at the corner of 125th Street and Broadway. It's a huge, lovely, open, heavily windowed facility. And we're hoping to have clinical research and trials presented in the center of that main forum area where we have our community board meetings actually. And we're hoping that those expert presenters will come from Columbia University Irving Medical Center. We've requested research, if they have a clinical, the latest research, some aspect of cancer that they may have be ready to present. And then secondly, their latest related to maternal well-being. And and also there's a lot in the news, even more about maternal mortality. That really is still a critical issue, particularly for women of color. And so that impacts families. And so we're hoping they'll have something critical there. And then secondly, youth mental stress. So that's why I was doubly excited to hear Pauline talk about what DOH has with its online tool. So we have requested some presenters in one of those areas. Around that central area where there are presenters will be the booths and tables where companies, agencies, pharmaceuticals will have some materials, perhaps giveaways, and have small group discussions to talk to people about pressing what those companies are doing, what those agencies are doing to ameliorate health conflicts and health risk. And let's see what, I think that's the central part. 11 a.m. is when it's expected to start until 4. And I'm looking forward to everybody on the committee playing a very important role. You guys are real busy. Some of you co-chair other committees, but there'll be something that everyone can help with, and certainly to be present. Mark your calendar. It is a Saturday. We initially announced it for February, and then Columbia offered us a March date so that we can avoid what might be bad weather, unpredictably bad weather in February. It may not be, but there might be. So March certainly sounded more pleasant, therefore more doable. So we're looking, we moved it to March. Today, thank goodness, I was able to get a letter out to Ross Frommer, who is Vice President of Government Community Affairs at the Columbia University Irving Medical Center, and he's an associate dean as well. We also talked in December, and you know, so he knows about this, and hopefully they can not only help with the professionals that are presenting, but refreshments that we hope to be there. Have it very similar to what he and his department did back in May last year, which was really just exciting and awesome with researchers, people of color researchers also. And so that people, it could encourage maybe some sensibilities about how research is done. And so we're very much looking forward to their saying yes. Event co-chairs, the Public Health Forum has a committee, and we have been active, not as active in terms of a group meeting in the last couple of months, because it's been primarily just putting to work what we need to have happen. But event co-chairs are Dr. Danielle Milano with Heritage Healthcare. She's the medical director, and Dr. Clotilde Manguia sitting right here, who's a member of our committee. And they have both been very busy. Danielle, let's see, is Dr. Milano still there? Yes, there she is. Thank you. If you will unmute and tell us, give us the update on the work that you've done in terms of who will be present.
Well, through the I have too many lights on here. With the Columbia, well, it's called the Manhattan Cancer Project. So there will be a mammogram van, and they will also have 2 people who will be doing cancer screenings. It's a little bit more than, so these are trained people. They go through, so basically it's colorectal cancer screening. We do FIT. They give out FIT tests, the FIT tests, fecal immunochemical test. And if it comes back negative, that means there's no blood, there's no, and then if it comes back positive, then it has to be escalated to a colonoscopy. Many of the patients are uninsured, and then the Columbia people will then send the patient to a Columbia site for a colonoscopy. And then patients are also sort of screened for, family history. And so, but basically it's the FIT test, colorectal cancer, and then it's the mammogram van. The patients for the mammograms must be registered in advance. And so again, that it will be the Italian-American, American-Italian Cancer Project, what this alliance, I think it is. So in any case, they will provide the mammogram van. We have to reserve the space on the side street. And we need a minimum of 20 people registered by a date later on this, in the 3rd week of February. There has to be a referral. So a patient, there's no walk-in for the patient. There's a bit of a screening that has to be done. Have you had a mammogram? When was the mammogram? Family history, maternal family history. And then also, have you had breast surgery? Have you had biopsies? So there's a screening tool that we also have to do. So we request that that anyone who wants a mammogram that just can go through Heritage, and we will create this referral. We will call you in advance. We'll remind you. The Cancer Project people will remind the clients, the patients, your mammogram's in a week, your mammogram's in 3 days, it's tomorrow. So, and then also what we will do, Heritage, we will have some tables, we'll do blood pressure, we'll do finger sticks. The people who are doing the cancer screening need some kind of privacy when they're talking to the patient. So we are looking at buying some temporary cubicles, or not temporary, but rent cubicles, so that the screener can have a private conversation with the patient. I'm calling them patients, you can call them clients, but the people who are there looking for screening. And I don't know what else to say. So blood sugar, blood pressure, all these very important things. So we have, we've been emailing. So What am I forgetting? Am I forgetting anything?
It sounds terrific. Not that I recall, these require vans. Let's see, the colorectal screening will be a van, right? And then the mammogram, the colorectal is not a van, or it is?
No, it'll be with the screeners. The screeners will give the fit test. If the mammogram fan is just for the mammogram. This is
Okay.
my understanding of it. I could be wrong, but the fit test
So
will
we
be
need
given
to
to the
have-
patient. Yeah.
So we'll need a special area inside the form, screened in area to do that. Okay. So no, I don't think you're missing anything there. Which means we just have to advance some form that goes out with our public announcement of this event. And maybe you can help, you can draft that, Dr. Milano, so that we need to
Sure.
mail it, do several mailings to see what kind of response we get. And some people
Yeah.
may not be able to do it that day. We may be oversubscribed, but they can have an appointment for another date. But at least we'll have the information, some kind of a
Yeah.
form.
So we
on the
do
screen.
have, so somebody sent me a form and let me look at, yeah. Hmm.
But if
Okay,
you can make sure
so,
we have that, so that we get it
Yeah.
out.
yeah, and we have it in English and Spanish. And so we did not create it, but I believe it was the Italian American Cancer Foundation. Okay.
Right.
Yeah, and so actually, people don't have to go through Heritage. So, Laquita, I thought you had this because I thought that this ultimately came from you, but evidently not. It might have come from Karen. And so in any case, I'm going to send this to you right now. The mammogram bus will be here Saturday,
Okay.
March 16th. Let me send these two things to you so people can get this flyer. They can, we are posting it. We're leaving stacks because people can call themselves the American Italian Cancer Foundation and schedule an appointment. And those screening questions will be done over the phone with the person who wants the mammogram. So let me send this to you right now.
And thank you, Dr. Milano, because that's a lot of work, scheduling and getting the commitment for these two departments or screening operations to be at the facility on Saturday. Let me add too that we have Dr. Marizzi here, and she has the Biz Bus. Did I say that right? Yes. The Biz Bus. And that's going to be exciting also. That's a training educational van. It's really great for young people, training them about science and technology. Dr. Marissi, do you mind talking about that? Because, and we have to, we need to schedule a meeting with Columbia's facility team, because they're going to need specifics on how we want to be set up. And so we have to do that with youth on our district manager, as well as the people at Columbia. And Dr. Milano, Dr. Mercy, we need to have that committee meeting. So we'll schedule that. Hopefully, maybe we can get it set up for Monday. If that works out, I'll touch base with them again. But they need to have it on their, it's on their calendar, what the word needs to go out. Can you talk about the Biz Bus?
Yeah, absolutely. Thank you so much for giving me space to speak about this. So we are, it's actually by a bus, but no, it's very, very small. Don't worry, very small. But there's a lot of buzz about the Biobus. This is like the running gags. We're like the Biobus. No, we love to be around. And again, unfortunately, at this moment, I cannot promise if I would be available to bring the actual bus, because we do have several events happening on that weekend. I was holding the bus for the February 10th event, but you had to move. That's fine. But don't worry, we will be there. I'm very, very happy to. We're going to be tabling, and I have fantastic youth that actually did health-related research. I think I spoke about the New York City Virus Hunters Project that actually looks at avian diseases that potentially could spread to other mammals in the city, but majority to birds, but sometimes also to humans, like speaking avian influenza and even paramyxovirus. I will bring this research done by high school students to this table. So this can be an inspiration for other researchers, but it can also be an inspiration for youth just passing by and see, well, you know, maybe this is a profession that I want to go into. So we will be there. We always make it fun. There will be mini microscopes and some fun samples for people to look and take a peek. So that's my 100% commitment. Again, I will look back if you actually can bring the bus, but I cannot make the commitment at the moment, unfortunately. But yeah, I'm very, very, very excited. And just hearing about the mammogram van, and I think that's like it's so important. Again, like bring this to the people and to reduce the barriers. And I'm also wondering, are you going to give out some PPE, because you just spoke about COVID and, you know, what preventive measures we still can take? Maybe that's a good place to have something available as well, like information, but also like some extra tangible help.
Yeah, we could,
Yes, we can look at Dr. Milano.
yeah, I was just gonna say, so we could on our tables give out PPE, certainly.
That would be
Yeah, I know.
fantastic. Thank
Yeah.
you. Yeah.
So I don't know that we can, you know, give a whole box to 1,000 people, but we will make plastic bags with some number of masks in it.
Great.
And if
Thank you.
there's
Appreciate it.
anything else, yes, and if there's anything else you guys think of that would enhance, that we can announce prior to the event, that would be great. So you'll be called, hopefully we can get that meeting set up Monday. I know they requested it in end of December, and I did forward information, but I gotta check back because I didn't hear back, but I know they want to schedule a meeting. We need to do that sooner rather than later in terms of the setup of the facility and getting the word out. Anything else anyone wants to add? I don't see hands up. Anita Chang is with us this evening. Last time we did see promotion pieces that she had, and we wanna, they're pretty much what was shown last time, in December. They're really nice pieces. Some of those, partners in the community put their own promo together based on what Anita had set up, and they sent the photos out. So we have 11 or 12 altogether to start with, introducing people, a lot of people to our partners in the community, like Koto Alliance, like the Bio Bus, like Heritage and Imabo, and these are places that people may know, but then a lot of people don't know that they exist to help in our community. So with Anita, do you want to add something? Because I definitely think we should show it for the executive committee. What's that?
I sent the updated PDF.
If you know how to, if you know how to use my computer to get it set up, I'd be happy to.
I think if you double click on the PDF in your email, the attachment, and then share your screen, I think that should be it.
And it's supposed to be a simple thing, which I have not
It's
done.
called update. The email is called update.
Okay, let me put Anita's name here, see what pops up. It should be the last updated drafts. Click on the file, double click.
On the attachment.
Okay, open file. There it is, and then what do I do? Like I said, I haven't done this before, but it's here. Let me hit share, save as.
Oh, you have to share in Zoom.
Oh, and Zoom. See, that's why I said, if you're trying to take it from here, and then we can come back. We can move, so it's not to lose time.
I'm sorry, but I don't.
What we'll do is I'll come, if Anita can use my computer to set it up in Zoom. Oh, here's Zoom. I don't know, I was expecting you to have your own computer. Oh,
If I was home, I could do it from my computer. You want to use my computer in the meantime?
Yeah, we know how to set it up, and then we can always come back so that we don't lose time.
Oh, do you mind sending forwarding the email?
Okay. Okay. Bear with me, I'll try to do this quickly because I know we're gonna run short of time. There we go.
See the meeting of today. If you're signed into the Zoom, you should be able to share your screen. Thank you so much.
Okay, I'll forward this to Clotilde. No, this thing is hiding my send. Okay, just sent it. Okay, so if we take, I want to thank everyone, just stay posted. As soon as the promos get set up, then we'll come right back to it. But are there any other questions on the forum, public health forum, or statements? Okay.
This is
Uh,
Christine. Sorry, this is Christine from Biobus again. You mentioned something very interesting right before. This is not my main expertise, but I would actually be very interested to see the vaccination rollout specifically for this district. So maybe we could set up a meeting at one point. It's just pure interest, like to see, and maybe I can also help with that for the future.
Oh, okay, that can also handle in the meeting that if we hold Monday aside, I'm hoping, Monday was a good day before when we were having the meetings. So
Yeah.
if I get the notice out tomorrow, hopefully we'll get enough response. I think it was Mondays. I think there were 1 o'clock meetings. If that is still good, I'd like to resume those, and we'll see if Columbia's available, and then if Anita's available on Monday too. But we have all of them pretty much completed because you guys did your own, but it's Community Members Care is the name of the campaign.
Okay.
Okay, so we're gonna move forward, and as soon as they get set up, then we'll come back to the promo presentation. Thank you all. Okay,
I think someone has their hand raised.
Let's see. Oh, and Tonika James's hand is raised.
Yes, hi, good evening. My name is Antonika. I put my information in the chat. I just wanted to know more about the opportunity to table for the event, for the health event.
Absolutely.
I'm with a
absolutely.
community-based behavioral health program, and we are sponsored by DOH, MH, and we offer free therapy and case management services. It's all free of charge. You don't even need to have insurance for it. And our workers come to the community members. We meet them where they are. So everything is done off-site. If people want to come to the clinic, they can, but we're trying to promote breaking down the stigmas in regards to mental health and understanding what different health conditions are, and getting that conversation started in the community, and really getting people the opportunity to unpack the traumas that they've been dealing with, and to really be able to speak on those things. And so, yeah, we would be excited to participate in this event.
Okay, and I do see your your information
for
now
anyone
as I
18 and
scroll down.
over. Yeah.
And what might help is if there's someone who can scroll down in the process. I just happened to scroll down. I'm kind of triple tasking, but h.james@housingworks.org. Thank you, and absolutely, we want you to table at the March 16th.
Great, thank you.
And then if there's anything in particular related to mental health, last year we had a whole theme on mental health. This year we didn't select it as a theme as much, but we're still dealing with that. And we're just pushing the public health forum for critical issues that keep coming up in our community.
Absolutely. Yeah, we're open to also hosting, we do mental health 101 presentations for the community as well. So giving people some definitions, giving them a lens of what mental health conditions could look like. And so if that's something that people are interested in, we're more than happy to also do that as well.
We'll be talking to you, Antonika.
Okay, thank you.
Okay. So let me quickly go. We're gonna probably, I'm not sure if you're ready yet with the promo, are you? And while they're getting ready, I'm gonna ask the presenters who have gotten West Harlem Development Corporation grantees to see if you can kind of cut your presentation, perhaps cut it by a couple of minutes. We'll still have Q&A, but so that we'll have more time for that. Let's, Anit, are you ready?
Need to give you permission.
Oh, I need to get, okay, so they're ready. I need to give permission to make a co-host. Let's see here. Clotilde needs permission. Oh. Okay. Okay, you should have, so you're not quite ready, or are you? Okay, so I just made our choice. Let's start with 3.5 Acres Yoga. You guys have been here before, but if you could just briefly, Timothy, give me your information, Timothy, because you're representing 3.5 Acres Yoga.
Yes. So my name is Timothy Lewis, and I am one of the board members for 3.5 Acres Yoga, and I also teach right here at the St. Mary's Community Church. So 3.5 Acres Yoga is an organization committed to widening the reach of mindfulness services, including things like yoga, breathing practices, and other mental health services to help to reduce the instances of stress, to also help others to connect more closely with themselves. And so our vision is that not only are we able to bring these services to the community, but we also support yoga teachers in specifically being trauma informed. And so 3.5 Acres is committed to teacher training and also, like I said, yoga classes. And this includes accessible yoga classes such as chair yoga classes. So like I said, I've been teaching at the St. Mary's Community Church now for about 2 years. And
The location.
this location is on 126th Street. I don't know the exact building
They're
number.
between Old Broadway and Amsterdam.
And this is a chair-based yoga class. I've been, like I said, I've been there for 2 years now. We're always looking for more members from the community to come to the class. It's a very community-friendly and accessible class.
So your grant this year was for what?
So the grant was for programming with the St. Mary's Community Church. This included the access to yoga classes to the community members there and the community at large, as well as extending some of the mental health services specific to reducing stress, also hosted at the St. Mary's Community Church.
About how many people are you servicing now from the community?
So on average, there are about 6 people who come consistently. Given the circumstances of recent outbreaks of COVID also in the church, one of the things we were talking about was making this a virtual offering. So some of the resources also have gone towards extending to the St. Mary's Church in a more expansive way.
What's the capacity? How many do you think you can serve? What number are you trying to get to? Or you think, it's not to put you on the spot.
No, it's an interesting question, and the reason that I smile is because it's an entire church congregation. So say 15 to 20 comfortably in a circle, absolutely.
And say a session to become completely immersed in yoga is how many sessions? 8, 10?
For some, it might be one,
Uh-huh.
because, well, one
You
of
do
the,
have to stick with it.
so because and the reason I say that is because one of the interesting things about a practice like yoga is, in some instances, it might be the first time that we've taken a pause to become familiar with the breath. So often, the breath is not something that we consider until it's something that we have to consider. And so to be able to take a pause and just literally tune in sometimes to one cycle of breath can be very healing for some individuals.
I wonder if you guys could do a demonstration or have something set up at the forum. I don't know if it'd be too busy to have people get in a meditative stance, but would you guys be willing to have a table? And the tables, I should mention to everyone, is free, it's no cost. But anyway, think about that and be prepared to let us know.
Absolutely. And it sounds like the event is happening on a Saturday.
It's a Saturday, March 16th, from 11 to 4.
And so the classes normally run from 2:30 to 3:30. So that might be kind of maybe an interjection into the event itself. A live demonstration.
Or maybe get people to enroll, talk to them about the benefits. And have some demonstration right there.
That'd be great.
Okay.
Are you open every day?
So our classes are specifically at St. Mary's, so on Saturdays from 2:30 to 3:30.
Is that the only day that you're open or that you provide the service?
Yes.
Okay.
And if you didn't hear the question, those who are here virtually, the question was, are the services every day? But it's not every day, it's on
Saturdays,
just Saturdays,
2:30 p.m. to 3:30 p.m.
2:30 to 3:30. Any other questions? Let me see if there are any hands. It's exciting and much needed, but when you get into it, it's a commitment for it to really work. Yes. Dr. Mercy?
Yeah, thank you so much for sharing this information. I would like to offer, if you have any flyers, I'm happy to let them, to showcase them at the entrance. We have a little booth for flyers at the BioBase. Again, it's like a very walk-through area. We are inside of Columbia Sacrament Institute, the entrance floor. So if you get in touch with me, and I can also come over to St. Mary's and pick up some flyers, I'm happy to spread the word so you can actually get more people from the community joining.
That's great. Thank you so much.
And these sessions are important for all the other community groups and partners that come to present, to connect with each other. So with that offer, hopefully you'll take it back. And we are finding that there are organizations that have connected, and we hope that you continue to.
Absolutely.
And definitely stay in touch with the community board so we will know what's going on as well. And you'll probably get some board members to participate. Thank you. We All Really Matter has also been here before. The founder and CEO, Stephanie McGraw, asked to do an update on their grant. And are you ready? Oh, so Stephanie, before we continue with you, just pause there. And we have our promotion pieces ready. So we'll quickly go through these. Dr. Mercy just spoke, and here's, this will appear, and even talk about how it's presented, the KYC and all that.
Oh, yeah, I think we talked about this last month, the Link NYC kiosk on the street. They, part of their, I believe, part of their, ability to be on the street is that they also have to perform, like some kind of community service. And I think that, we did this is our third year or a third round. The first two rounds were for COVID. And finally, we're doing something different for mental health. Monique had a great idea. I think she's the one who proposed it. And Laquita is bringing in so many partners. And so some of the, we're kind of developing these. Some of these are further along than others. So if you have any, corrections or thoughts or text changes or image changes, please let us know as soon as possible because we would like to get them out.
And so these will appear at the kiosk, as Anita said. And so let's go back to kind of, this is BioBus. And Dr. Maritzi worked with the wording and all on this. And it's like, hello, my name is Latasha. We also thought about calling it or continuing the hello. I like that. Anita had done that with the COVID hello. I think it was with COVID hello.
Because we did it with individual board members.
And it was done with individual boards, but it's still nice. It's a hello campaign, but mainly community members care. So the next one, this is our, we have to give it a title. This is Community Board 9 Seniors Action Committee. And they're doing a lot of, Liz, I don't know if you want to add, I know you guys get theater tickets for the seniors, they get meals. There are a lot of activities, there's discussions on Medicaid update, there's a lot, in terms of gatherings. This particular one meets at the Jackie Robinson Senior Center. So maybe we can find some way to do a heading. Walter and Carlton can help us out with that. Okay, the next
Does
one.
the
Oh, I'm
MCB9
sorry.
have a QR code of any kind, or maybe we can generate one that goes to
This is
the,
the community board, we have to
City-
probably generate one.
that's a good idea.
Okay, the next one, our board chair, Victor Edwards, talked with, and it's, if I remember correctly, I have the name incorrect on that one. That's not Sia Street, but we'll correct that. And she actually, it's already been corrected, but it just, the name didn't get corrected on there. But that's one with the Columbia University's Irving Medical Center. Okay, and this one was the Emma Bowen Center.
They gave us two photos, so if they want to choose which one.
I
is
love this
better.
one where they say, never give up. I think that says a lot right there, never give up. Lifelong wellness and behavioral care. I think that's really strong.
Yeah, I like
I
that.
think one problem with these is that, people are driving by on the bus, they're just seconds to just see these. And with so much information, I'm afraid people won't get anything. Right?
It is a
Because
lot
it's
of text.
too dense.
So we have to ask them to cut their text even more. But say never give up, that says a lot.
Yeah.
But it's something we have to ask to
People will be
cut.
able to read it because it's very small,
Right.
but.
If you could do your comments next to them, maybe I'll send it to everybody and just put your comments. Okay, so
But there are
the
also
next
people
one.
who are on foot, who will be right
Right.
there, so we could have things for both, people at different speeds.
Right.
Like, bus speed, train speed, car speed, pedestrian speed.
Okay, the next one.
So like
And-
that's quite a lot of text.
That's a lot of text. That's Dr. Milano. That's a lot of text also. And but I love the picture. And they work to get their public affairs person to get the, photo approved and all of that. And the information is good. It's just because it's as people are walking, if we can reduce it, that would be great. But it's engaging. Okay.
So
And then
no
this one
problem.
is-
Yeah, but I already for that photo, I joined one of those, where you buy the photo. And
Right.
so I already have that.
The
Yeah, if
photo
you
is
I like the
great.
picture, yeah.
If you can send me that photo, this one is just I'm just putting in the small one.
I think
Okay.
I think your agency sent this, Dr. Milano, her public affairs person. So
Right,
if they
but it was
can,
the
Oh.
wrong, it's the wrong format because the Link NYC kiosks are all the same size. So they
Oh,
have to be a certain size.
okay,
So
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 I put
this
it
is,
into our template, which is the correct size.
okay,
so
I'm
you
going
can get with Dr.
to,
Milano.
okay, I'm gonna send this off to Grethel, our former AmeriCorps person who is now our coordinator of performance improvement, who is a technology whiz. So I'm gonna,
But all you need to do is send me the photo and the text.
okie dokie, will do.
A
Okay,
reduced text. And
yes,
actually, we're not
Yeah.
putting the addresses and all. If there's a
Okay.
phone number or
Okay.
QR code, the QR code.
Oh, yeah, I took out the QR code. Okay, gotcha. All right, so seriously,
That's
I
our
have to send this to
streamline it.
Grethel. I have to send this to Grethel to take.
Okay,
Okay, thank you.
but it's engaging photos, so. Okay, the next one, that's the Jackie Robinson Senior Center at Grant Houses. So again, they probably could reduce their text, we
They
need
have
their
a
logo.
director.
Yeah, and the director's name, I sent her name, in the, we just have to
The
pull it
new
together.
director is Manuel Alves.
Oh, golly, another, okay,
He just started this week.
okay. All right, so the next one. That's Monique's, the Kidney Foundation, that's pretty succinct. We just need
So,
the QR code and we need the,
Yeah,
logo.
I think that's like this is a much better model, I think, for like conveying, you know, like relevant information, but keep it distinct, and then like hopefully we'll have like a QR code up there, so someone can like take a picture. I
Right.
think that's a much better model.
I think this one works.
Yeah,
I like this one because of the spacing.
the space, the text is easier to read.
But
Yeah.
it's the same template for everyone and the size of the text is just, the amount of text determines the size of the text, if that makes sense.
Okay, let's see the
So
next,
Monique, I think, if you don't mind sending me, the correct logo to use for this.
and we're trying to get this off pretty fast so that they can start running in January. Cause I don't know, it'd be great if we could put something, saying Public Health Forum,
Yeah.
March 16th, so that's why we need to really have information quickly.
So we can do several rounds of promos for the one.
Now, COTA, this is COTA Alliance. Again, I love their photo, but less text. 'Cause I see
That's a
what,
lot of text. That's
it's a lot of text,
So
but the photos are great.
who don't know, for the people, you know, that say hello and then there's no person,
Right.
I could put the name of the organization, like I did for COTA, like this. So if you put
Okay.
that, please let me know,
COTA Alliance.
or just COTA Alliance, it's up to you, but let me know if you have.
Well,
a
we're
preference.
introducing the agency, so yeah, I like COTA Alliance. Hello, this is COTA Alliance.
Okay.
Yeah. And I'm not sure, this
I
is
haven't heard from
Osborne, me either, so there've been some changes there, but so we'll move forward. And Tall Omega Charitable Trust, it's okay to not be okay, really grabs you, that probably could even be larger, but the only thing at the top, it really should be Tall Omega Charitable Trust. West Harlem Development Corporation, probably since they're giving you a grant, but they're not running the program. So the focus should be the Tall Omega Charitable Trust. This is Tall Omega Charitable Trust.
That's fine. We'll take that correction.
You wrote
Okay,
that
just
correction?
send me an email, Wendy, or.
Okay.
I think we've done a lot of work on this,
But mainly West Harlem, they could be smaller at the bottom somewhere, but it's Tall Omega, it's okay to not be okay.
I can't move it to the left because the person's head is higher on the left.
Or just reduce the logo some.
It can't be small, if it's smaller, it'll be harder to read. And it's a circle, so it's already difficult to read.
Or
I think
moving
if we
forward.
take out the West Harlem, that'll make it a little less busy.
Okay.
Excuse me, this is Stephanie McGraw. I've been patiently waiting to do my presentation and I have to get to another event. And so I just wanted to let everyone know
This is
that.
part of our health forum, so we're just about wrapping up and you
So
are
these
next.
two are the last ones from
Jesus.
teenagers.
Okay.
So
All right, so we'll get back to it, and Anita, thank you for all your work and all the partners for participating, and we'll make those corrections and modifications based on being in touch with Anita and you talking. Okay, thank you again. So Stephanie, thank you for waiting. Sometimes it happens like this. We don't intend and purposely to keep you waiting, but go ahead with your presentation. And you have, Warm has presented before. So basically, I guess what was, the main thing is, you have an exciting program. What was inspiring in terms of receiving the grant this year and what you'll be able to do? You're muted.
Yes,
Oh.
good evening. My name is Stephanie McGraw. I'm the founder and CEO of WARM and a survivor of domestic violence. I want to first thank the West Harlem Development Corp. I want to thank Community Board 9, the 2-6 precinct, the 3-0 precinct, and the 3-3 precinct for allowing us to come into this space to do this incredible work. We are so excited and so grateful to be a recipient again of this grant, which has enabled us and allowed us to continue to expand to do this life-saving work. You know, I was listening to the forum, and you know, I very rarely hear when we start talking about mental illness, domestic violence, and it is a big gap there, and domestic violence is very connected to mental illness. You know, a lot of women are suffering from PTSD, post-traumatic stress disorder, a lot of things that, and a lot of these men that commit these crimes have a lot of mental illness. A lot of these women that are in these abusive relationships also suffer from a lot of mental illness. So I was listening to the presentation, and it's often not spoken about as much as it should be. But we're so grateful and honored to receive this money, because what it will allow us to continue to do is to deal with this crippling effect of domestic violence. And as you all know, we work in marginalized and underserved communities, and particularly where there is a large portion of Black and Latino women that don't often have an opportunity to receive and get this life-changing information, educational work that we do to eradicate domestic violence in our community. We work very closely in grant houses and also in Manhattanville. You know, we've had a woman that was murdered a couple of years in Manhattanville. We did a march around Manhattanville with Shauna Brew, who we work very closely with, people in his office. But right now we have a workshop going, you know, and that's why I was like, I have to get back to the workshop. So we started our support group started January 1st. It will go all the way into June 24th. And tonight workshop is simply just giving yourself permission to heal. You know, women that are in abusive relationships don't really have the space and the time to really allow themselves to heal. They're the caretakers, they're in the community, they are holding up the community, and they are the ones that really, women are the ones that hold this community down. So when you're in an abusive relationship, you don't really have the opportunity to heal. So our model is simply, we help women feel, deal, and heal from traumatic, vicious cycle of domestic violence. We are doing some life-changing work. I think we sent over a whole package. I don't know if you're gonna show the slide that we sent over, but we did previously send over a whole slide of all the work that we are doing. So last year, when we got the grant, we were able to serve 439 new active client. This year, the closing of this year, we were able to serve 635 new clients, women and children that come to our center on a daily basis. And because we have this partnership with NYPD, and we're the critical response to some of these cases, we have officers bringing women and children directly into our center. So we're able to expedite them, get them the help they need, get them to a safe shelter, get them the counseling, help them go to court, and just help them unpack their lives in a very safe and loving environment. And because most of the women that work at the center are survivors, it is such a deep connection. Like, okay, we're a bunch of Me Too sisters. So to have this grant to help us to continue this work will help not only the community, but it will help the whole city. Because when women heal the women, heal the nation. So some of the things we do at WARM, we're excited. You are all welcome to come visit our center. Our center is open 6 days a week. We're at 8 West 126th Street on the 3rd floor. We have a complete wraparound services there. And we also have a store. Because sometimes when women and children are escaping, they leave with just the clothes on their back. So we have Pampers, we have toothpaste, we have lotion, we have care packages, wellness packages, we have female products, but just the basic needs that women may need. We have Similac, the basic needs when a woman is trying to escape, because we are the critical response team, and we also are the first responders when there's a woman murdered in our community. We're called in by the police. We give the community an opportunity to heal, to identify, to get some healing, and to talk about this issue where it's still considered to be a shame in our community. Unfortunately, that's why we're here, to expose it for what it is. Domestic violence is really a crime and not a shame. So some of the services we offer emergency victim services, immediate shelter for women and children. And when we can't find them, when we're pulling women and children out, we put them in hotels to keep them safe until we're able to get them to a safe home. We also have victim crisis and safety planning, mental health and referral to mental health, HRA applications we do. We also do, because of the influx of migrants, we are dealing with that issue. We had over 500 families come through our doors for the Christmas holiday toy drive. We literally ran out of toys. So this year we're going to start collecting toys in June. But because of the influx, we've been seeing the numbers increase. We have an OVS contract where we're able to help anyone that have dealt with a crime in the city. If there was a loss of life in the city, we are able to help them get the $6,000 burial cost. That's from OVS. So we do those applications. We have emergency food, emergency diapers. We also help with emergency locks change. And we help families go to surrogate's court sometimes when a loved one is murdered in the streets, and if there's no will. We help with those things. We have ACS supervised visits at our location, because we work very closely with ACS, amongst other things. But some of the work that we're most proud of is our workshops that we do from January to June. We also was able to open up a 12-week certification training course for victims of domestic violence. This is also recognized by ACS. They use that in court. They've completed a program. We have post-traumatic stress disorder and trauma, because women that are in these abusive relationships, it's not just from Vietnam vets that come out of the war. out of war and dealing with PTSD. Women that have been in domestic violence relationships as well are also suffering from some of those issues as well. So we have grief counseling. And, you know, we're just so excited about all the work that we have been able to increase because we received this grant from West Harlem Development and working in Community Board 9 and the space on the west side. It has helped us to bring awareness and education to these communities that are suffering at a higher rate. Thank you so much.
Was that a question? Did someone have their hand up or wanted to make a statement or a question?
Oh, I forgot to give the phone numbers.
Yeah, I was gonna
Okay,
ask Chair,
Chat.
Chair, I was gonna ask if we could get the contact information for the
Yep.
organization. So thank you
She
for,
just she just mentioned, I asked her if she could drop it in the chat. Let's see if I can move that down.
but I did have a question also.
I can put all
Okay.
that information in the chat.
Okay, please do. And your question, Monique?
I was, so you started talking about the influx of migrants, and I wanted to hear a little bit more in terms of how you're even managing that crisis, because we in this community already have a need, and resources are limited. And now put on top of that, the influx of migrants, and I don't know how many of them have made it up to Harlem, but I was just wondering if you could elaborate a little bit more in terms of how you're addressing that.
Yeah, so thank you for asking that question. You know, we had officers call from the 46th precinct over the weekend because we have about 22 precincts, and there were 2 migrants that didn't have any ID. So some of the things that we have been able to put in place is they have a women's shelter in the Bronx on Franklin Street, but they have a center specifically designed for the migrants downtown. So when we come into those issues, we send them down there. But we have, during the holidays, we have had over 40% of women and children coming up in need for Pampers and clothing and toiletries. And so we have been able to give what we can because we have a large population here in Harlem of women and children that are in need as well. So we have done the best we can, but we didn't turn anyone down for the Christmas holidays. That's why we ran out of toys. But yeah, it is very, very stressful for everyone at this time.
Thank you so much for the work you're doing.
Yeah, and I'm gonna put our address, our phone numbers. I think you have our email, but I'll put it in there as well. And we do have some events coming up, Love on the Block, that starts in May when the weather changes. So I'll be sending all that information over to Community Board 9. And if any street fairs that you are doing, we would love to be a part of any of those events. We would love to participate, but I'll put all of our information in the chat.
Thank you, Stephanie.
I'm actually multitasking. You see, we're doing our support group tonight.
Very quickly, it would be great if you could participate on March 16th. And there may be with a table, maybe have people there discussing, someone may want to privately come up to you or a representative from WARM, so if you can make yourselves available to have a table and people there, brochures, whatever, if you need privacy, we'll send out a form and if you could respond to it, that would be great.
Oh,
We appreciate
absolutely.
it. Thank you for coming and making a presentation available. And when you send to the community board, also send to the committee chairs, because if we, as fast as we can get the information, we can send out to the committee as well.
Absolutely. And thank you so much for having us.
Yes, any other questions or other for Stephanie? Okay, keep up the good work. Congratulations again. And now we'll move to Wendy Millett, who's been working with us, with her program dealing with young people and mental stress. Wendy who is chair of the board for Tall Omega Charitable Trust Fund.
Thank you for the introduction, Laquita. Chairman Laquita, excuse me. Is it possible for me to share my screen? I have a very quick presentation
Yes.
that I'd like to.
Yes. Whoops, this moves so quickly. Okay, you have it.
Okay, so Chairman Laquita introduced me, so I don't need to do that again. But we have received grant funds from West Harlem Development Corporation for the second year, and we'd like to thank them, as well as thank your committee for your support. So our program is to provide young people ages 17 to 25 with relevant information regarding the signs, symptoms, and possible treatments for anxiety, depression, sleep deprivation, and stress. These are mental disorders that they may experience in their daily lives. I'll share some highlights of our activities since August. And I'd like to just thank the two board members, Sharon Cook and Rosin Grace, for their attendance this evening. So in August, we participated in the Harlem Day event on Saturday, August 19th. At the event, we shared our promotional materials, flyers, backpacks, and stress balls, and introduced the program to many of the throngs of people who attended the event. In addition to promoting the Making It Through program, we distributed information about our scholarships, college fair, and family daycare library programs. On October 7th, we collaborated with Tall Omega Chapter to sponsor a college fair at Harlem Academy. As a co-sponsor, we provided 2 workshops on mental health that was attended by young people and their parents. In addition, we provided program promotional items for inclusion in the swag bags provided to attendees and a box lunch for the young people who registered in advance for workshops. Continuing to work with co-chair Laquita Henry and this committee, we were privileged to participate in Columbia University's Manhattanville Community Day on October 21st. Our mental health professionals interacted with event attendees to introduce them to our program services and assist students with issues they were experiencing. As a result, our mental health lead, Sharon Cook, who's on the call tonight, was interviewed and quoted in Columbia's Spectator newspaper coverage of the event. And in one of the pictures, you can see Sharon chatting with Anita Chang at the bottom.
Yeah.
At the invitation of a member of Tau Omega chapter who teaches at A. Philip Randolph High School, 2 of our mental health professionals conducted workshops for senior students during 5 periods on December 20th. The workshop gave the students insight to recognize the signs and symptoms often associated with common mental health challenges. The interactive sessions enabled students to ask questions, share their experiences, and gain professionally appropriate responses in a safe environment. Our program is social media based, and we recently disseminated our first newsletter, and that went out in December. So thank you for the opportunity to present this evening. Follow us on our social media accounts and subscribe to the program. We're extremely appreciative of the support we've received and look forward to continuing to work together for the residents of Community Board 9. So we expect or plan to be at the March 9th Health Fair. And I also
16.
16,
March
yes, March 16. I have the date down already. It's
Okay,
still
we
a
don't want people to
conflict
feel
for
that
us, but
left out.
I will make sure that we have a table and people and our information there to participate. Because as you can
Thank
see,
you,
that's how
Wendy.
we get the word out. And just listening to the other presentations tonight, I'm gonna follow up with Antonika James, Pauline Ferrante, and Christine Marizat.
Marizzi,
Marizzi, as well as
Uh-huh.
Warm, because in our newsletter and on our website, we can use their information since they are providing similar services to us to let people know these are other resources for them. Once again, thank you very much. If there's time, I'll take any questions.
Thank you so much, Wendy, and thank you
Yes.
for keeping it pretty brief and to the point. Let's see, I don't see hands up right now. Any comments? It's been a pleasure to have the cooperation and support of Tall Omega Charitable Trust Fund, especially as we've tried to work to put the public health forum together. And it's just made everything so much easier and smoother, as well as with, having a real vibrant committee. If there are no other questions, our chairman, Victor Edwards, is here. Victor?
Yes, good evening all. I was wondering if your newsletter, is it available on your website or can we get copies of the newsletter?
Most definitely. And I will add you, I'll add both of you and your
District manager
to our email list. So when they go out, you'll get them automatically.
The second question is, do you distribute to local community centers as well? Manhattanville and Grant have, vibrant community centers for young people. Do you distribute there as well?
We do not currently. If I was able to, and that's a challenge we've had. If you had lists with addresses and contacts, we would be more than welcome to add them to our email list. The religious institutions, we developed schools, a list for the schools and for the housing developments. But if you have any lists that you can share with us, we would be more than welcome to add them to our lists.
Will do, will do.
Thank you very much.
And I know that when I do the email of the announcement of the agenda, it's to about 68 persons who are heads of their organizations or work in their organizations. You'll already be included. So maybe there's 90. I can, maybe we could do something there too, interchangeably with all of the flyers that the groups have, and just keep the network growing with that exchange as well. Great question, Victor. And good information, Wendy. Thank you again.
No problem.
Now we have 3 other important things as a committee to discuss. I'd like for, as quickly as possible, Clotilde to kind of do a wrap up on this stress, the issue of stress, and particularly stress on the holidays.
You might need to make her a co-host. I think I saw Laquita actually remove you.
Yeah, I did, because and then we need to maybe let's spend 10 minutes with the stress and the holidays or less. That includes Q&A. And then we need to go over the City of Yes proposal, as well as make some comments related to residential parking, which people think we have spent enough time on discussing. So let me, with participants, go back to Clotilde, make co-host again. Okay, so if we do that, we could get out hopefully by 8:45, 8:50. As long as Clotilde can make hers abbreviated. Do you need a little bit more time? How much time do you need, Clotilde? Because we could go on to discuss, while you're setting that up, we could possibly look at the stress issue after the city of yes? How many of you got a chance to, on the committee, got a chance to review the city of yes, the ZEO proposal? Anybody?
I looked at a few, the 18 proposals, right? There are like 18 different, I think.
Right.
18, yeah.
I'm on proposal 13 now. That's where I stopped. Heather, did you get a chance to look at it? Monique, did you get a chance to look at it?
I started to look at it briefly, but I didn't finish looking at it.
It seems primarily what, and Victor, you can correct me if I'm wrong, but it seems primarily that the city wants to make it easier for businesses to, or business-minded people to be able to have and operate a business in the city without as many restrictions and what they may consider complications and perhaps too much regulation. Now, of course, I can see the perspective on that, but I also see areas where the city or this proposal is asking people to use reasonable good judgment. And oftentimes they're saying common sense or just, well, I think the expression mostly is reasonable judgment. And reasonable and rational to some people, a great number of people may not be so reasonable and rational to others. And I think that's where the complication comes in. And also it's going to depend largely on the landlord making certain kinds of concessions also, and we have to be really diligent. It's going to need some more work through to see how we can make landlords more accommodating, especially to very, very small businesses which may also be having problems just making ends meet, but they can work diligently and economically out of their homes, but if they can get more foot traffic, they may still need more of a break in terms of paying rent. So that's what I'm seeing. I think it needs more work, but I think there are possibilities. They talk about moving some businesses to floors above to higher level floors where they may be on top of residential apartments. That can be good, but if you know a business is coming in there, or that business knows that it wants to be or can operate on a higher floor, then you're talking about, or we have to be talking about insulation, soundproof, noise proof, and that's going to be more costly. And who's going to meet that cost? If the businesses, if the landlord is saying, yes, you can do this, is the landlord also going to be responsible for making that possible? So I can see the city of yes saying, okay, we're tired of saying you can't do this, you can't do that, and restricting people's ability to make more money, especially since people want to stay at home. They don't like necessarily working for someone else. Since COVID, that's increased. So I can see the possibilities, but I also in these possibilities see more regulations because people are people. And then they can say yes, but then when they're in an actual situation, it can become complicated as a law. Anita?
Oh, I actually this was a while ago, but I think I went to the presentation by the Adams administration on behalf of the housing city. And it's a long list of regulations being relaxed. And what I was thinking during the whole presentation was most of these were enacted for a reason, right? For reasons because people were asking for them or they needed them. And so I think just adding to what you're saying, Laquita, I thought the two that were the most, because I don't know very much about it, one was the laboratory, relaxing of the laboratory rules for scientific research. I think they have to self-certify that they're safe, and I'm not sure how that is
Yeah,
gonna go.
there's,
Like
yes,
you
one of
said,
the
Lupita, and
proposals.
also the increase of making it easier for nightclubs and for, I think, under 200 establishments. I think those two were the ones that jumped out at me. Things like, you know, loading docks and, parking, you know, I agree are probably antiquated, with the new deliveries. But, I thought those two were, I thought it needed a little more regulation than just self-regulation.
Okay, so we're really kind of saying the
Yeah.
same thing. It needs to be hashed out, really, because reasonable judgment, that can be, you know, we're not sure what, it can mean different things to different people.
And, you know, I think maybe we as the Health and Environment Committee, some of the feedback we might be interested in providing about one of the proposals that you touched on, Laquita, letting businesses occupy floors above the ground floor. The one thing that I think concerns me about that proposal, and I think feedback that the city would probably be open to, is ADA compliance, because it's much easier to make a ground floor business ADA compliant. But how do you do that maybe in an older building that lacks an elevator? You know, so I think that's something that jumped out to me.
Very good point.
Yeah.
And also, one more, very good, and also, for C1 and C2, it's proposed that they'll be available for personal and business service, entertainment uses, transient accommodations, and wholesale establishments. So I think this is a big change.
Yeah, I mean, you know, residential people going up with walk-ins for business, you know, in the elevator.
Change. A lot of these changes are gonna be very big, and it's not gonna be what people signed up for when they moved into their apartments, right?
Right.
So you moved into your apartment, you know, how many years ago, you didn't know that, you know, there would be a laboratory or a business or a bar or a transient accommodation next door to you. Right.
Or right
So-
above, stomping, and well, you know, and you don't know if those persons, even though they say they'll agree.
So if you move into a building, you know, and you live above a bar, you know that you're gonna live above a bar, right? And so I think a lot of things are gonna happen that people didn't know before they moved in, because it's happening afterwards.
And how do you accommodate that? Is the landlord going to tell you in advance that they'll help insulate, or is the you know, that bar or restaurant going to? I mean, there are problems already with that issue. Victor, what have you found with committees? Anything you can share right now, or?
One of the things that came across one of the committees was commercial establishments in a residential building on upper floors. People have talked about fumes, depending on what they're doing. Something as simple as coffee grinding or making. Fumes carry throughout the building.
Yeah.
Now, if you're doing something industrial, same thing, noise, and then the amount of people coming and going out of your building. That's, you know, it's residential, you don't expect a certain number. Now, someone has a barber shop on the 5th floor. People are coming and going.
What if the elevator breaks down?
Right. So I think we have to be cautious with the city of yes, that some of it has to be, maybe we need to take a closer look. And it also said that DEP would regulate some of it. Well, is that after the fact or prior to the fact?
Yeah.
Will they be able to approve what goes in a building, or you'll have to call them complaints after they're already there?
And how many complaints before they act on it?
Right.
And so how long are you gonna be uncomfortable, which could be months, maybe years?
On the kind of regulation and review level, you know, the city right now is experiencing record vacancies across every city agency right now, right? And the mayor is slashing funding for city services, so that might really affect DEP review or you know, even an external kind of regulating agency, you know, when there's like something like record vacancies in city agencies right now.
I think the collapse we had of the garage not too long ago.
Yes.
Something cited something about lack of inspection over a period of time, so cuts coming up. how's that gonna affect? DEP is gonna have to come out and inspect, and you don't have those people anymore, and you have that number,
Exactly.
so we have to be cautious, you know?
I
Um,
think the
I'm sorry.
intention is good, but, there are too many factors. Monique?
Yeah, I was just trying, I mean, because I was looking at the spreadsheet and we're talking, I mean, there are like 18 different proposals. So are we as a committee, like going, it sounds like we're only going through certain ones. And I was wondering if you can reference the number. And then I'm assuming we're going to be writing in the responses as we're talking on the ones that we're honing in on. There were a few that were where health and environment was noted, but we're talking of, it seems like across a lot of different proposals. So I just wanted to be clear, which ones are we talking about and expressing a concern in terms of a con?
I see 14 proposals right here. I haven't gone farther, but I understand there are 18.
Correct.
And we were having just getting general feedback just then to our overall impression, because when I asked if anyone had read it, most people had not read it as thoroughly, but they keyed in on certain ones as they were probably skimming through. And I know I have not completed it. So I think we could take the comments and probably apply them to the references people made. But looking in, on what we have, let's say proposal 9, support nightlife with common sense dancing and live
Yeah.
entertainment rules. That's what I'm saying, common sense dancing, who's gonna establish that? We have to maybe be prepared to come up with some
Can I
suggestions.
just interrupt one second?
Uh-huh.
I don't know
I didn't see
if
that,
you
but
have Sydney had sent the spreadsheet, and next to each item, she labeled which committee should take a closer look at that.
Oh, you know what,
think
I
that's what
don't.
Monique is-
okay.
Yeah, this way.
Okay.
You don't have to do all 18 if you don't have time, but focusing on the ones that are health and environment.
You know what, let me put in Signy's name and see, I think she did do that.
I think you shared with me the spreadsheet then.
I probably didn't, but what I pulled up on my own, I didn't pull that one up.
While Laquita's looking, I mean, yeah, I think in just looking at these quickly, maybe because I didn't go through the whole presentation and maybe I missed something and I'll try, but for all these things that are being proposed, I am curious to know what is going to be in place to kind of follow up and make sure that proper protocols are being followed. And I guess that's what Victor was saying. We already seem to be having problems following up on the current stuff that that's been reported in the news. Now doing these new things, what kind of structure is going to be in place to follow up? I mean, I think that the ideas sound great because we are looking to try to spur growth and development. And the items that are, if I were to put my cannabis task force hat on, I could see a number of proposals that make sense, but my concern is just the ability to enforce or control or, make sure proper things are being done.
Right, there's something here with cannabis task force, but I pulled up the spreadsheet with proposed details. I see economic development, here's down here, health and environment, relevant committees for.
Oh, Victor, has anyone proposed,
Proposal.
a process for exemption? So instead of just doing away with all these regulations, to create a process for exemption, so there's a control before and not just a massive cleanup after.
That's a good
That's
idea.
right, no one has, but that's.
What was that? I'm sorry, I couldn't hear it.
Say it again, Anita.
Oh, to create process for exemptions. So that each one is, considered, goes through a process, and instead of just a blanket release.
Right, you would have exemptions for certain, situations.
So
instead of
if
just
you
saying
want
yes
to, create a laboratory or a bar in a residential building, there is currently no process, but then they create a process and it can be controlled. And allowable, right?
I think it's a good idea.
Because they don't want a city of, they want a city of yes, so it should be yes to process.
Mm-hmm. That sounds like a great recommendation. That we should try to incorporate. I am getting the proposal numbers, now. And it would make it go, faster, 10, 11, although it is on number 10, 11, 13,
Ground floor.
14, oh golly. 10, 11, 13, 14.
Auto body shop is right here.
15, 16, oh shucks.
Oh, those are help that you're reading numbers?
Uh-huh,
Oh, okay. A lot of it.
it's a lot of them, 15, 16.
I have a quick question. Where it says relevant community partners, we're supposed to give an example? Can you guys hear me?
Yeah. I don't know.
Victor?
I'm not sure the answer to that.
Okay,
That was Sydney's sheet, which was a big sheet. I just don't know what she meant by that.
okay. I mean, I guess we'll get further clarification, but, yeah.
I mean,
Well.
at face value, I would say yes, what other community partners should be involved in maybe making a comment to that particular item.
Okay, got it.
We could suggest, yeah, something along those lines.
I just had it, oh darn. Okay. Okay, so she suggested, it's practically all of them, proposal 3. See if I can pull it up again. Oh goodness, let me see what proposal.
Do you want to share it, so that people can look at it?
Well, I'm trying to pull it up again, and yes, that would be good. I wonder, are you?
Clotilde's ready.
I'm ready, but I think it's really better that we discuss everything and then we're gonna wrap because it's really unique. This meeting,
So make sure you have time.
Mm-hmm.
3-4 minutes. I will do that.
I pulled it up not too long ago. And I have let's see, I shared it before, did I do that? Okay, the city of yes,
The spreadsheet, right?
I think I have it. I can read.
I have the spreadsheet, but I was gonna pull up the actual proposal.
Oh,
I
okay.
think it has a very brief description of each proposal, so.
Yeah. Yeah. I mean,
can-
I have it open if you wanted me to share.
Read proposal 3 quickly, we'll just, if we can go through it quickly. Proposal 3, that's not
Well,
just what a.
Small
to look
scale
at.
production, allow small scale clean manufacturing businesses in commercial areas.
And what are they suggesting?
You mean in terms of,
Proposal.
are
There's
you,
3 parts to it.
I'm looking at the spreadsheet. So when you said 3 parts of what?
They do a proposal, here it is, it's come up, I got it up. Oh darn, this is real homework.
If I had to guess, maybe there are regulations where you have to be a manufacturing business of a certain size in order to gain access to commercial real estate, and maybe this proposal is, hey, let smaller scale manufacturers get access to those commercial spaces. I mean, I would need the project, kind of the in-depth document in front of me, but I guess again, just taking a guess at how the proposal is phrased here.
Laquita, I can email it to you.
I have it right here, but it's not opening the way I need it to open, the way I had it open before. I have it right here, City of Yes for Economic Opportunity, but, here's my scroll. Can anyone just read the rest of, proposal 3? What it is supposed to do and why they want help to look at it? I did have it open, right, as this,
So from one of the documents, small scale clean production, manufacturers of niche products such as small batch food, apparel, and furniture tend to serve local consumers and want to co-locate with retail or service components of their business. In recent years, New York City has seen growth of maker-based businesses, for example, experiencing 510% growth in the number of breweries, 140% growth in the number of coffee roasters. So these seems to be, you think about it like a brewery or your coffee roaster, like Plowshares, where they both manufacture a product on site, but then they have a retail storefront as well. So you're brewing beer in your commercial space, but you also have a tap room. You're roasting your coffee beans in the commercial space, but you also have the coffee shop. So I think this is a proposal geared towards that kind of like.
number 3.
Yeah.
Because this says, it does have some restrictions. This says allow small scale clean production businesses in storefronts and office buildings limited to 5,000 square feet in C1, C2 districts and limited to 10,000 square feet on the ground floor in C4 to C7. But we have to know, C4 to C7. Uses subject to ABC and right to know environmental standards. So they do have some limitations on proposal 3.
Do residential building boards get to vote on the?
Say that again?
The boards of a residential building, cooperative condo, whatever, get to vote on the type of business that's coming in under.
That could be a suggestion here. That could be a suggestion here to make,
Yes,
but it was expand opportunities for small scale clean production. I mean, I can see that. I mean, that sounds simple enough. That one I can see under 3. Small scale, because there are regulations in terms of how, like a brewery, ceramics, 3D printing, bakery, apparel, jewelry making, most of those are already, well, they're ground floor, but I can see the small scale clean production.
small scale.
So I can see that subject to ABC and right to know environmental standards. So as long as that's operative, then I can see that working out. And you guys can make a note of it and then give feedback again, but let's move to proposal 5, enable commercial activity on upper floors. I think we made, we did our critique of that with the potentially noisy uses. We already have a proposal related to that. It took DEP some time to respond to the community, but they did. I just think we'd have to say installation and be required to approval before that business moves in. That's what I would say with proposal 5. Enable commercial activity on upper floors. We pretty much responded to that. Now, proposal 7, clarify rules to permit indoor urban agriculture. Now, that's something that's been discussed a lot with, I mean, the problems with cannabis, the odor, the smell. I think the same thing would probably apply to indoor urban agriculture. Odors, and even going beyond that in terms of food and all, any potential infestation.
Yeah.
Which happens with, because it's a crop. So clarify rules. Basically, there's this saying clarify. So yeah, I agree. We should maybe we could come back with some pointers on that. dealing with, as I mentioned, infestation, odors. I guess roots, making sure they don't grow in below to, whatever damage can be caused with flooring to the resident below. Any other thoughts on that? They're saying they clarify how enclosure rules work to ensure that businesses with passive outdoor spaces such as floors can operate. So, we clarify, we make the rules clear. I can see that. Monique?
I guess in terms of filling this out, I'm just trying to understand, we're commenting and we're supposed to be looking at the pros, the cons, and then further feedback in terms of if we're for something or against.
Or make a statement in terms of how to ensure that it can work. Or if you don't think it will work, just state it, you don't think it'll work.
Okay.
For example, proposal 8, they're proposing Anita?
Oh, just, sorry, going back a little bit, it seems like clean manufacturing, I personally don't know anything about it, but it seems like it's a technical term actually, and it doesn't have to do with what we think was clean.
That's what I
do with carbon footprint. And it doesn't have to do with, like the kind of chemicals used or whether they're, hazardous to humans or not, which we might assume. It doesn't mean that. It means that it has some kind of, carbon offset or lack of carbon production. So it doesn't have to do with, other kinds of, whether or not it's good for humans who, might be living there.
So maybe we need to expand on what our version of clean is. In terms of what we want, is there anything more than the carbon footprint?
Yeah, just not assume that it's, clean for humans, it's just clean for carbon.
So let's say we clarify clean, the word clean. Not just carbon footprint. Okay, so we've kind of covered 1, 2, 3. If we go to, and I'm doing this kind of quickly, proposal 8, they're proposing under give life sciences companies the certainty to grow. And Anita, you already raised concern about that, but clarify the definition of a laboratory to allow any life science business to locate in C districts if it can meet environmental standards that protect neighbors. I don't know how we ensure that, but we can say, I'm just not sure that's a particularly good idea. We might want to make an exception to proposal 8.
Creating uncertainty about where safe. I mean, I was thinking as I was looking at this, the creation of a laboratory, I mean, I guess you need more clarification of what that means, what that entails. Because I thought about, again, cannabis, there's opportunities, I think, to have a laboratory. Laboratories are important to help monitor the quality of product that is being produced. And I think that that can only be maybe done in places where there's a lot of space, but it would hope to drive business downstate. If that was defined, I mean, that seems like an opportunity with proper, enforcement and parameters. That's the word I'm looking for.
But see, there are already problems. There are already problems with enforcement. It's just not enough of it. And I think, if we go for all of it and then not go for some of it, I think that's okay. I don't think we have to make it work just because it's here. I think we have to, you know, put our limits on too, how much is yes, I don't know, I see the laboratory thing, like you said, Monique, needing space,
Yeah,
but I am concerned if we're talking about above residences. Because it's just gonna be hard, and some people are gonna wanna do what they wanna do, and they don't care if they can make $1, what the neighbors think, or they feel that they can get by for a week and let people be uncomfortable. I'm just not sure. Thanks, Anita.
I think if we, once again, as Anita said, define or say with, with clarification, it might be something that can work. So, so maybe it's not above a residence, but it's on the ground floor or something of that nature. Because
Yeah, maybe that one we could insist on, and even it would need some insulation,
Right.
materials that they use to, keep, I don't know, fires that can start in these laboratories or, explosions. Maybe there's something it would need to do to, maybe it wouldn't be buildings, but it would be like, say, next to, maybe it could be close to a residential area, but not in a building. Maybe that would be the yes that we can offer.
Right. Yeah, I mean, something like that. Just in general, you want to make sure you have proper ventilation and, like you said, measures to contain. So maybe with making sure those things are in place, we could say yes, but it has to be depending on the setup, the building. I mean, this picture showing Harlem Biosphere. So that's the old, was it Mink building or something?
That's what it looks like.
Right. I mean, maybe a building like that, which is not, I think, residential, it can work. So.
And I think some of these we just have to say no to. I really wouldn't mind saying, no to changing this. But I don't mind, really all they're saying here, let's be, more clear. They're just saying allow commercial life sciences facility to locate on community facility campuses. So really that's more limited. I don't mind that
Right.
so much. Yeah, if it's just campuses, community facility campuses, unless like they're calling a campus, like Park West Village is a campus, but is a residential campus, unless. No, I think but I think they're talking about, special permits and going through special regulations if they're on. It's already a facility, campuses, so that I could go for, but not with residences.
Right. I mean, campus implies a school, so I don't know. Come out and say university, but in this case, this picture is showing a building that looks like it's a commercial building. So I don't see why we couldn't do something.
It is, but behind it is another commercial building, and next door to it is a commercial building.
Right.
Right, so there is in a commercial setting.
Right. So I think that you could do it in this kind of building. Now, I don't want to belabor this because I know we have a few more, but I mean, I would be okay doing something in a building like this. It's not residential.
Right. Okay, so proposal 9, we already had, let's see, support nightlife with common sense dancing and live entertainment rules. Again, it does say here, clarify zoning to regulate nightlife based on nightlife and still subject to permitting and enforcement, but it doesn't say material. If the word materials is there, it means the landlord or that business has to insulated sound.
Yeah.
Discriminatory rules around dancing is not, so I don't want to eliminate people's culture or what they do in their fun life, but insulated where it's just contained within that space. So I think we'd have to say, materials, because there's an expression like that with one of the others, insulation. Anybody else have any concern about that? Because we just got through people having strokes and everything behind the loud music after 10 and 1 o'clock. And I mean, 10 o'clock may not be late for a lot of people, but weekdays and raids, but you know, we gotta be consistent in thinking about the community. So I would be okay, but I'm for insulating, checking everything out before, so the sound stays within that and it's regulated beforehand, not after someone gets in and they say, well, you didn't tell me before that.
Well, that goes back to enforcement, right?
Well, I'm saying beforehand. Enforcement is not going to be enough.
No, I
after-
meant, sorry, what I meant was, if we're saying that there has to be some entity that's gonna be like like making sure that that is happening.
Right.
That's what I meant.
And enforce beforehand.
Yeah.
Okay, so we can put that down. Now, number 10, create more opportunities for amusements to locate. I think that's similar to the entertainment piece. Arcades, I think it's easy with our general arcades, virtual reality and children's entertainment. I think there probably is a need for more in communities for children to engage children, keep them out of having to go a great distance or getting into trouble in ways that weren't necessary. If the facility was on, closer to their community. But again, I think sound insulation is the issue. And again, there could, sound, maybe crowds outside, people wanting to get in, especially if it's a small space. How do you regulate crowd and attendance?
Mm-hmm.
I mean, you're dealing with that even with the cannabis, and we're not even talking about cannabis with this, but there are dangers, health risks there. As well as, not being able to control everybody all the time. Potential, not everything creates violence, but potential, depending on what the entertainment is, to be popular and attract, aggressiveness. Any other issue related to that, anybody sees? Okay, so now we're on to 11, enable entrepreneurship with modern rules for home-based businesses. But now they do say maintain existing noise, environmental rules, signage limits, and restrictions on selling items not produced on site. Remove list of currently prohibited business types, expand size allowance. That's 11. We have 4 more after this. Any reaction to that? Because they do say maintain existing noise environmental rules. I think it's more than noise. I think some things that we always have to put odor, chemical manufacturing smells, fumes. Again, I don't know about if there are elevators, people are already cautious of getting on the elevator with people in small settings, and these buildings are, would have smaller elevators if they have elevators. Any other comments on it? Okay, so we'll move on to number 13. 11, we just finished 11. 13, reduce conflicts between auto repair shops and pedestrians. Oh, we have a resolution in place on that one too, where the auto work was being done on the street, people having to cross the street or walk into the street just to get past the cars. And again, the smell, the odors are great, and lack of cleanliness, the people cleaning after themselves. When I say cleaning after themselves, I'm talking about if you repair a car, fix a car up, you may have oil on the side of the pavement, the motor oil, whatever other kind of oils a car uses, the fumes, noise, people working. So
Yeah,
it's not that they are bad people, it's just that how are we gonna regulate them, you know, sanitizing or cleaning up after themselves each day? So they're saying allow new light auto servicing uses. Okay, light auto servicing. Whew. A light and heavy vehicle repair and maintenance shop, heavy repair shops must be registered. I think it's gonna be pretty much what our proposal already stated, when we submitted it earlier last year and had a meeting with the auto repair shop there. It's amazing, we've been in advance of a bunch of stuff, oh God. Let's see,
we're still
Yeah,
on
but-
11.
I was on 13, reduce conflicts between auto repair shops and pedestrians. We have a proposal, we can go back to our proposal on that.
Oh, 13. Okay, yeah.
Because remember the auto body shop at 140 Broadway, between Broadway and Riverside on 133rd, I think it is.
Uh-huh.
Okay, I'm just trying to move it along. Proposal 14. Create a new use for micro distribution facility, so delivery activity can locate at a small scale closer to homes and offices. I mean, I can see that, that's like UPS and giving them more distribution facilities. I mean, they use Rite Aid now, some of the pharmaceuticals, Dwayne Reed, like for delivery of packages, small packages. I can see this one.
Mm-hmm. So we're saying to increase the number of places where items can be dropped off. I think I'm looking at deliveries with micro distribution.
Yeah, that's it. Let's see, streetscape rules would prohibit papering, papering over of windows to deter dark stores. Yeah. You go past, you don't know what's going on in there. Yeah, I can see that. That's number 13. I'm gonna move to, or was that? That was 14. So we got two more. 15, facilitate local commercial space on residential campuses. I don't have a problem with campuses because it's hard to find certain things and they will have to abide by campus rules also. And there's some campuses, like even downtown Manhattan, is it at, whose campus is it? Or even up at Columbia.
I think this means residential campuses, like public housing blocks,
Oh, yeah, like when I said, Park West
like
Village.
brick houses.
Yeah,
and,
okay.
You know,
Oh, wow, that's a little bit different. Although some of them are okay, but some of them got to be so big, and around Park West Village, they're closed. They opened up just a few years ago, and now they're closed. They were too big, and I think people, you know, like Whole Foods is probably doing good, but then some of the others are not. So let's see, approval only if development would not create traffic congestion or environmental concerns. Yeah, if they listen to the landlord, but we have to really engage the landlord. Property owners want that, you know, for money. They don't care about anything else. But I could agree to this based on approval only if development would not create traffic congestion or environmental concerns. Monique, anything you have on that, Heather?
I mean, I think that makes sense. We want to make sure that we can control that traffic.
Yeah. Cause I'm very pro-business. I just, but some things are proven not to be so great once, you know, it satisfies the landlord, but it hasn't satisfied the community.
Right.
Which
Doesn't take the
means that most
community.
of these, would have to come before the community board, and I think that's something we can add. That we make sure some of these proposals or the businesses accept it, just like the liquor license and all of that maybe come before the community board for perspective. That's like getting their neighbor's perspective. Same thing like with cannabis, you know, getting, the community's perspective.
Uh-huh.
Which they're not gonna wanna do, but I think that will help a great deal with enforcement. If not, we can go on to the last one, number 16, create process for allowing new corner stores in residential areas. I think we need a variety of corner stores. It doesn't always have to be a deli grocer. But it could, there could be some interesting things, even some restaurants are nice, corner. But subject to both environmental review and community board approval. Some dress shops. I could go along with this one, approval only if development would not create traffic congestion or environmental concerns. I could see that. Art shops. Any other comments? I know we went through them quickly, but if you guys could take a look at them between now and Wednesday, and then I can, just based on these comments, please, 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 Amir, we need help. There's so much stuff to do. Can you take a special look? I know Heather has another committee. I don't want to put anything extra.
Yeah, sure.
Okay, so Amir, Elizabeth, we, you know, see.
Okay.
Because what I'm gonna try to do is see what I can hit with these minutes. You know, well, we need December, if you think you can do this one, but not as long, only just synopsis. No more than 3 pages, just a synopsis.
He said he has to record.
It's, yes, I have it recorded.
Yeah.
So he's coming back, I'll be doing next door for something. Okay. So we've covered the ZO proposals. Amir, if you and I can talk, on Wednesday, please give me a call if you wanna call during
I
the day.
can't get, I'm actually leaving the country on Wednesday, but I can send you an email with some feedback on some of the.
It could be tomorrow, doesn't have to be, yeah,
Sure.
and just do the ones we had, 3, 5, you got those
Sure.
written down?
Yeah,
Okay, and I can incorporate consideration there. Thank you.
Sure.
If you wanna do it tomorrow, that's fine.
sure.
Send me a text, cause sometimes so much email comes in, it's like with these minutes. Clotilde did, she did like 12 pages, that's way too much for anybody to read, but she did a great job. But I couldn't find her 3-pager.
Mhm.
Sometimes I just have too much email.
I said the first one I sent you was.
Yeah, okay, I just have, you know, too much email,
I will
so.
send it to you.
Well, you know what, let me try to look for it, because then that's the other thing that happens too, just too many.
Sure.
So I'll look for it. But if you can do these, I'd like to have these ones so we can submit. We're so behind. I gotta make sure Patricia hasn't left us. You know,
So what is it you need me to work on? Another significant list?
let's see, if you can look over these proposals, you got the numbers down and see look what they recommend and see what other little wrinkle. Be as critical as you could be, because we live here, and the reason I say be critical, not in a negative, but like, what would the community want? Because, we represent ourselves, but we also represent a whole bunch of other people.
So what are the numbers again?
3, 5. Yeah, 3, 5, 7, 8, 9, 10, 11. 13, 14, 15, 16. Those are with health and environmental concerns.
I'll look at
And just email, don't do it past, let's say tomorrow, well, it's fresh on our minds now, cause see, we meet on Thursday night, it's gonna be too much for me to try to put together if I wait till the last minute. Just do what you can.
Right, I mean, tomorrow is a busy day for me. I've got
Give me a night.
my other committee, and then I'm chairing a meeting.
Do it while you're sitting in another committee, cause they probably be going over it too.
No, that, the seniors, I think we're doing the person tomorrow.
Oh, seniors definitely will have some interesting
Yeah.
input.
It's a little tight tomorrow, cause it's back, cause I work through the day, but I can see, it's a little tough.
Or if you feel up to it when you get home, look at 3 or 4 tonight and then 4 tomorrow morning. We all have the same.
No, I know, but I mean, I'm being real, you know, so Monday, Tuesday, that we have the back-to-back for me is a little.
But if you do get something in Wednesday, just shoot it over.
I'll take a look. With the training stuff.
Let me see, so that way everybody's doing something, okay, so now, the whole thing with the residential parking. I think we ought to just, I know that, we could go forward, we can make changes, but I think we ought to, we haven't gotten additional feedback, more stuff is happening. There's gonna be congestion pricing that, impacts on us. I'm of the mind, and actually I could do a roll call vote tomorrow. Everybody look at this proposal that we have, what would be your suggestions? Submit it, we can always make additional changes. And if you're just totally opposed to it, you can vote no, but stuff is gonna be happening whether we vote or not, and that's what I'm concerned about. We wanted to have a town hall, we requested with Victor doing a town hall, and I wanted to ask him if he came back, because we said, I say we, Edwin and I, sent even a proposed flyer. Because we really need to have community input, and we just gotta say something, because otherwise, they're ready to vote on this in March. And I know congestion pricing is gonna be voted on real soon. Somehow there's something I read with residential, and I sent myself notes.
I don't think the state legislature is gonna take this as a priority.
I agree.
And I don't think it'll ever happen anyway, which is why I think it's such a shame that
But
we're
let's just-
wasting our time on it. Because the city.
We don't know what's a waste of time, though, that's the thing.
I just don't, I've talked to a lot of urban planners and local politicians. I've spoken with O'Donnell's office, I've spoken with Sean Graves' office.
Are you close to Sean Abraham's office?
I have some, contacts in his office, yeah.
How do they feel about it now?
They say what every politician says, they can see both sides.
Well, yeah, that's what I was trying to even get us to do,
Right.
last week, we didn't get too far with that.
But
that's some of
just
it.
seeing the time, I do support tabling discussion of this, because it's already 9:00 and.
And then you know what, it's already got a temporary approval from the committee. We'll just go forward and I have you as a nay
Yes,
from before. And let's just see where it goes, cause it might be a nay executive too, at least we'll be on record as having, it wouldn't have been a waste of time.
sure.
So I
No,
like that
it-
part, let's go with our prior
Here.
vote. And then and feel free, things can, we can change, we're not like stuck in the mud, you know what I mean?
I'm trying to find the actual proposals again, I can't, when did they come out?
October. And it was sent, or I know it's passed out here at the meeting also. I'll write it down, I don't wanna take time to look for it now, cause I know I'm,
Built in October.
sometimes, it was,
From you?
I think we voted, I sent it, yeah.
Okay, so I'm looking at you and.
Uh-huh.
I too have.
September and October, we need to wrap up.
I don't
It's
think
not-
there's ever a vote on the.
Yeah, there was something, and cause I remember saying to Patricia, we needed to add the numbers of the vote.
Yeah.
Something like that.
It was what?
Continue the discussion.
We did talk to continuing the discussion, but there was also a vote. Let me see what that vote was on, because I remember also, based on that, we sent it to transportation, and they were also supposed to look at it, and we worked together on it. So I know there was something for it to move, to share with transportation, but I'll find it.
Call a vote.
I'll find it. If it wasn't, I don't have a problem with it. Like I said before, I'm not feeling like I have a real dog in that fight, because I can see both sides.
Yeah, I don't wanna be a stick in the mud, if folks wanna.
But you're on record, but I remember
Yeah.
something like that. So let me just see it, and let me make my notation so I won't forget. Resolution, I'll just circle this whole part. So we're all done, except I think because of the time that Clotilde, we're all done except for Clotilde. We want her to do
Yes.
some kind of wrap up, stress and the holidays. And we're pleased to have her medical expertise. Let's see who all is. I knew that the public session was primarily, done. Let me just see who we have. Clotilde, Monique, and Heather. So Monique is our only person. Thank you, guys. We still have a quorum, 2, 4, 5. Yeah, 6, Monique being virtual. So we only have one person, Patricia. I gotta find out my girl, Patricia. Okay.
Thank you. I would like, if you can be like 5 or 9.
And speak up also.
Yes, yeah. And then, now it'll be like 6, 7 minutes, like 5 minutes, you let me know,
Okay.
then I'm gonna wrap her.
Okay.
So,
And thank you for Clotilde for pulling this off. We were supposed to have it in December, but Clotilde was in Dubai and the time schedule was off.
and
Violins playing now as she was in Dubai. So anyhow.
yeah, first, I would like to, wish all of us happy New Year. And, even though my title today for this presentation was Stress and the Holiday, I think the title has completely changed. It's gonna be more a wrap-up of everything we said. It's a very unique opportunity to have had today, tonight, so much partner about mental health, about environment, about a sustainable development. So here what I'm gonna say, as you see, I have 15 slides, but the intent was not to go through the 15 slides. The intent was to make some key pointers, and tonight you have given it to me. I didn't know I would be more than a grammarian, I would be a note taker, so I can summarize what we've been doing. So let's go for the first one. We talk about, my topic was about seasonal affective disorder, but it's really about mental health. And if you see what West Harlem has in terms of resources, if I have to ask all of us, we are sitting here with all our partners. We know, we just demonstrated that we do have. I cannot tell you what is the number for the lifeline to call if I'm in the middle of a crisis, but today I think I can feel already that part here. Now, in terms of statistics, we know we don't need number. It's individual, it's local, it's in West Harlem, it's international. So let me introduce myself. My name is Clotilde. I have been selected in May as a board member. I sit on the Health and Environment Committee and as well the Economic Development. I work mostly internationally, but my work here really transcends the border. I'm a medical doctor, I'm a reproductive health, public health as well. And I can tell you that I never thought that to have that platform, even when I go overseas, I carry West Harlem. I compare what the others do and what we can do or leverage and do better. So I'm not gonna go through those statistics. We just know that they are rampant. We just know that we are exercising a crisis. Now, we also know about what are the main challenges. I'm not gonna go through that. The idea is not to define for you what is it, what are the symptoms, etc. But maybe I would like to point here the risk factors and the population in West Harlem that we really need to focus. in terms of inclusivity, in terms of leaving no one behind in this community of about 150,000 people. Women, four more times, young adults between the age of 18 and 30. We did not mention anything about handicap. Today, I didn't hear that, but we know we have that in our art. We also know about family history and genetic on mental health. We are sitting with top-notch researchers and university. They are our partners, and we're gonna be working together. Substance abuse has been talked about widely, anxiety, eating disorder. We didn't mention too much about our senior because even though they are not really prone to mental health, but they have unique risk factors that we can look at as well. So now I want to go back to what was talked today, and it's more about key words. We talk about environmental standard, but what comes really vividly I want to put is how we can make it better. This city of yes will not be only yes, yes, yes. We have seen that it could be a city of no. If it doesn't meet our need, we need to be able to raise that concern. Community engagement. We are not working in silo. We have partners. The community is part of the chapter as well. And we would like really to tell all of us, all of those who are online today and join us, that we are so deeply appreciative for the work you've been doing in the community. That really tell whose city the District 9 is, that we have all our hands on deck. Some of the problems that we have encountered, I can see, unfortunately, technology skill. We managing computer and this, we live in a world we have no choice, innovation and technology. A big problem is definition, the understanding of the semantic of the world that we say, clarification, definition. We talk about mental health and clinical and climate change a lot. We know how both are related. And I can tell you that now the climate change also take into account the impact on health. And that's not only in West Harlem, but it's worldwide. Let's say how much resources and how much money they will allocate on that. We talk a lot about in terms of environmental standard and mental health, not only mental health, it's well-being, because we know how climate change affects non-communicable disease, communicable disease as well. A lot of things has been earmarked about ventilation, the pollution. We are going to respiratory crisis. We have young children, even old people who are affected. Asthma is growing. We are aware of that. We mentioned about the sound and relate that to the stroke. We talk about urbanization of New York. New York is a whole city. Demography is rampant. Our infrastructure are old. How are we gonna make it? What is the guideline, protocol, policy maker? We know that all these are on the table here, and we are showing that we are partners. Now, I want to write and say about how we're looking for perfection. We have seen that more than what we've been doing. It's just a tiny job, efforts. We are not even enough people to deal with all those challenges. But we know that we have also opportunity. We don't look for perfection. We will not deliver everything. But what we can say now is that I like that sentence that I've learned here. I prefer to fly the plane when we are building it than just to sit and just don't do nothing. We did not talk too much about management of water. I didn't hear any sentences about water, which is very, very crucial as well. And I want to hand here and say, what is our call of action for West Harlem? Care about community and sustainability. To manage our resources, that means we need to know where are those resources? Are they adaptable? How can we promote the well-being, but within equality, taking into consideration the disparity, the accessibility, the affordability? So very important. So we also are working that you can be in good health, but we need to do something. Economic development, we've been working on that, we talk about that. Let's talk about aggressivity, the sound, the distraction, the impact, I would say aggressivity and the violence. Nothing will be achieved if we don't maintain a very inclusive community and we promote intergenerational contact, connection within a peaceful environment. That was discussed. And then to hand about partnership. We know it's not, we have different background here in West Harlem. How many culture, people speak French, English, Spanish, whatever. Collaboration is key. It's very key. Collaboration is key between ourselves, our government, the public, the private, civil society. So this is about what I was about to tell you. To conclude, for the seasonal affective disorder, because we are still in that time of the year where there's less light, where people suffer. This is not because I didn't receive that dress or I didn't have the money to buy, I'm feeling blue. No, no. This disorder, the seasonal affective disorder, it's a subtitle of depression. It affects your core, your mental, your physical. So you need to know that you don't need to be an expert, but we provide the resources here. Mental health, the department just spoke about that platform, that's not unique. Tonight we have shown that we have those resources. Now we need to compile them to know at our finger point where to get them, how to disseminate them to reach those that were looking for us to be the ear, the nose, the speak, the whatever you say. And we want to tell also that those community need to know that they are not alone, that seeking help is important. It's a sign of strength, not of a weakness. But we also need to know that before, when there's a fire, before going and helping others, look at yourself and empower yourself so that you are equipped with the necessary tools to go and provide help. Thank you.
Thank you. That's okay. Thank you, Dr. Clotilde.
So I hope I summarized. So there's no question to take at this point because we stayed home already. I just hope that it's recorded because it's gonna be quite a lot.
It is. We're not too bad, but still, there's always so much people ask me.
Yeah.
I thank you for taking the time to pull something together. and what you pulled together, and I know we have a couple of other things that we were asked to do, and we'll be, reviewing them or slipping those in, from time to time. Thank you all very much. Is there anything else, or old and new business? I just want you to know that items 6 and items 6A and B will always be here, because what I want people to do is remember resolutions, letters of support that we have done, and then, so we'll, we're an action committee. We haven't had, any other resolution other than the, residential parking, but we have the public health forum that we want to be big and impact the community, in ways where, maybe on YouTube, they'll see it, they'll get information, through coming and picking up pamphlets. We'll be more educated in terms of how to talk to them, and through our, Link NYC, people will learn. So we have, different platforms. All right, if there's not any new or old business, I will entertain a motion to adjourn.
Motion to adjourn At-
It's been.
at 9:20.
Who seconded? Who,
Oh.
you said I so moved?
Yes.
Okay, you have to word it that way.
Yeah, I so moved.
To adjourn. And I think Monique was adding the time, 9:20 PM. So the motion is, seconded by Amir Sadehi. And all those in favor, say aye.
Aye.
Thank you so much. Our committee showed up. We always get a quorum in here. And, we get the quorum without the virtual, but we're pleased that Monique is virtual, but, that's the rule now that we're virtual. I'll be at the executive on 11, but I already, sent an email to Victor that it's going to be, back to be virtual. I'm helping to take care of a elderly friend of my mother. Okay, and goodbye.
Thank you, Clotilde, for your presentation.
Yeah, my friend, my friend.
Okay,
Yeah.
all right, so okay, Monique, good night. Thank you for your presence.
Thank you, guys. I'll be there in person next time.
Yes, yes.
Now I know.
Okay, now let me stop the